Hello everyone, my name is Omarzaman Sayedi. I am the former Technical Director and Deputy Chief of Party of the USAID Health Sector Resiliency Project in Afghanistan. I am currently a Senior Technical Advisor for Health System Strengthening at Palladium. I am pleased to share with you my experience in establishing a one-stop shop approach that was introduced between 2015 and 2020 within the Afghanistan Ministry of Public Health to reduce bureaucracy and increase clarity on the processes for establishing private health entities. Previous to the one-stop shop, investors wishing to operate in the private health sector were besieged by endless red tape, confusing and contradictory procedures, and the risk of corruption as they navigated a winding bureaucracy of reforms and approvals. To register a new business in the health sector, such as a hospital or a pharmaceutical company, it took the ordinary investor months or even years as they shuttled back and forth between different governmental entities for various clearances. To better understand the obstacles to private health sector licensing, the first phase of the project was to map out the existing pathways to licensing in the health sector. Findings from the mapping exercise revealed a number of barriers to a clear and efficient licensing process. These included over 20 different licenses were required to be issued by government ministries or directorates. No single source or guidance regarding documentation, information, or support for licensing existed to guide prospective business owners through the registration process. Lack of interdepartmental coordination resulted in isolated work streams and a lack of clear lines of responsibilities that led to errors, duplications, or delays in the application process. Unstructured department functions without clear job descriptions or standard operating procedures clouded the work of the 5 licensing entities. Bottlenecks in approval occurred due to a lack of proper review and follow-up process for erroneous documentation. Overlapping or redundant functions created 30% additional labor for no added value in the process. The Afghan one-stop shop was therefore proposed with the following objectives: to provide a professional environment that will increase private sector interest and willingness to grow and invest in Afghanistan's health sector, to provide effective communications and coordination between the government and the private sector, and to provide effective guidance, coordination, and facilitation that will enable a rapid and smooth decision to invest. The one-stop shop enabled investors to access all licensing services from a single location where all government entities, including the Ministry of Public Health, became stationed. The idea of a government one-stop shop was based on experiences from other countries like Egypt and Lebanon, where local governments created a single entity to handle the full suite of registration and licensing services. In addition to streamlining services in one physical location, a website was developed for the health sector that contained useful information for existing and new business owners. Following the collapse of the previous government almost a year ago, the health sector one-stop shop has continued to operate, mostly preserving its original structure and processes. However, the one-stop shop website is no longer functional and is not accessible due to a lack of system maintenance. Thank you for your attention.